Welcome to 21st Century Health. I'm Jackie Bales. In order to receive federal stimulus dollars, hospitals, clinics, and physician groups are switching to electronic health record systems. So, a lot of legacy systems are being replaced. However, healthcare organizations are also required to keep data for up to 28 years. Joining us with a solution is Shelley Peters, President and CEO of Legacy Data Access. Welcome, Shelley.
Thanks.
Shelley, this sounds like quite a dilemma. I mean, needing to keep the data for almost 3 decades, but at the same time implementing an entirely new system. It's got to be a huge challenge.
It is a huge challenge, Jackie. Hospitals are riddled with information systems that automate everything from billing to clinical to radiology imaging. And the latest initiatives with the EHR and the dollars that President Obama has offered to hospitals and clinics to actually implement standardized systems across their healthcare organization has forced a lot of hospitals to standardize their offering to not only internal customers but external customers like physician groups. So a lot of hospitals are having to do these large implementations that are standardizing their billing, their clinical, their orders, results, radiology, and yet they have all of these older systems left in their data center that have a lot of valuable information in it.
And let's talk about your company. I mean, your name really says a lot, Legacy Data Access. Tell us who you are and what your approach is to solve this problem.
Okay. Well, basically, we go into all those older systems that we were just talking about, and we mine the data out. We put it in an open sourced application where they can access all of that information via the cloud. And then they have that information available to not only their internal customers, but their external customers, and they can retire all of the old software, all of the old hardware, and yet continue to have access to the information.
Now, obviously, your solution dovetails with the EHR initiative, but it also seems broader than that.
My solution is strategic. We try to be the place that all old data resides. So anytime a hospital or a clinic says, what happened to that old billing system, what happened to that old clinical information system, they always know is with legacy data.
You know, I know your motto is strategic, simple, and secure. How is your solution really simple, though?
It's simple because they don't really have to sit down and go overly analyze what it is they need to extract. We model the application that we build off the old application, so it's very simple for the users to transition from one to the other, so they understand where their data is and how to access it. And then the support model is simple because what could be easier than, hey, if it's old, it's all in this one portal. I don't have to worry about having a login ID to some obscure machine that no one remembers what the address was or what it was called, hasn't been turned on in 6 months. You're going to get all those people together to try to get that one piece of data out. We've greatly simplified that process.
Really see where that would be enormously valuable. Speaking of your customers, who are your typical customers?
Well, we obviously service large IDNs that have many hospitals and clinics, but we also have 35-bed hospitals and physician clinics. Really just depends on the customer. Is anyone that had an old system that needed to be retired. That old system can be sitting in a 35-bed hospital. It can be sitting in a 4-physician clinical practice. But if they've been collecting clinical data, financial data, and they no longer have access to that information in their new system, which a lot of hospitals and clinics can't convert data, then that's our typical customer.
And why do you think companies should be looking at your services now? I mean, primarily because of the EHR initiative?
Well, yes, actually, the Electronic Health Record Initiative has gotten a lot of organizations on a strategic path to standardize all of their solution set. A lot of hospitals are going out and buying a lot of physician practices. They're bringing those physician practices into the fold of their organization and into their EHR solution. But doctors have been working on electronic charting and things like that for quite a long time. A lot of them have physician practice management systems that they've been using to manage their practice on the financial side. And a lot of this acquisition activity is leaving a lot of those older systems behind.
Oh, sure.
So I would say in 18 to 24 months, a lot of hospitals are going to be faced with the issue that, yes, they've got all their new physician practices on their new EHR, and everyone's charting, meaningful use is met, everybody's happy, they've got their money, but the doctors are raising their hands saying, help. I have this old system back here that I legally and clinically need access to, and it's got a lot of good data in it. What do we do about that? So it really is bringing our solution to the forefront. It's really giving us an opportunity to talk about our strategic placement in a lot of organizations and how we can go back behind the scenes and clean a lot of that up for these hospitals, because it's going to be a large resource intensive project to go and help these physicians then divest themselves of the older information systems yet not lose all of the data.
And looking toward the future, Shelley, what is LDA's long-term approach?
Well, our long-term approach is to continue to plug in strategically to our customers, to supporting them to make sure that they not only leverage the value with the data that they've retired, but also the value with the data that they're continuing to collect in their current production live solutions. So we are continuing to plug in at the project management office level, at the CIO level, at the strategic level, to keep our customers informed on what kind of data they have in their older systems, how are they using that data, how it's helping their current production systems, how it's helping them drive their current business, and how we can keep their costs minimized, keep their return on investment positive while they continue to move forward and tackle new technology.
Wow. Well, it sounds like you're providing a much needed solution as healthcare organizations are really being forced to update their data storage. Thank you so much for explaining this to us, Shelley.
Thank you very much.
And thank you for watching. For 21st Century Health, I'm Jackie Bales.